So just see the first question of the day. Besides being a moral imperative of welfare state, primary health structure is necessary precondition for sustainable development. Analyze. Yeah. Just read the question and give me the framework. Yeah. What is the model and framework for this answer? Besides being a moral imperative of welfare state, primary health structure is a necessary precondition for sustainable development. So Rajni Chase, definition of welfare state, how primary healthcare is important for welfare state, ways to achieve it, drawback and way forward. Okay. So basically you need to explain why primary health is necessarily a precondition to the welfare state. Okay, so what are the points you will write? Jitender, what will you write for this?
Yeah, so sustainable development goals and how quality of life linked to health.
Okay.
How it lead to vicious cycle of poverty, by increasing out of pocket expenditure. Educational outcomes and productivity, how it will be distorted by health. And also this investment cycle. So poor health, low savings rate, low investments, less growth. Finally, it will impact economy.
Okay. Sriram?
Yes, sir.
What will be your answer for it?
Same, sir. I will start with welfare state. What is the object of welfare state? What is moral imperative of welfare state, and also how it is important primary healthcare is, and where are the provisions, and also what are the necessary precondition for development and reasons for calling primary healthcare as a necessary precondition. In conclusion, sir.
Okay, good. Rajni, you want to add something?
So we can talk about the cognitive tax, that if the development of the children is not happened properly for the first 1,000 years, it affects them for the rest of the life, and the poverty cycle continues.
Okay, but how is the primary health structure? Okay, you want to just add the point of children dimension?
Yes, sir.
Okay. So basically, the question says that what is the importance of primary healthcare in sustainable development? Okay, in the context of welfare state. So the issue is, as a state, there are certain responsibilities for the government to take care the important social conditions for the citizens like health, education, etc. In this context, state definitely has certain moral obligation towards health structure, and only when the primary health structure is in proper place. So very valid points given by most of you. Only when the primary health structure is in the proper place, it will lead to healthy life of the people and going forward for a sustainable development. So you can just introduce by the definition of welfare state, where state has certain obligations towards the people, and then how primary health structure is the key component of the welfare state, you can explain. Okay, so you can say that the primary health structure is an obligation towards the welfare state. Then you can quote some examples of, how health is important, and it is enshrined in the legislations, and also it is there in the constitutional values. Okay, all these you can write, and then how health as primary health, not having primary health as a direct impact on various socio-economic and political aspects of the country. Okay, you can write that, and then you have to write how primary health structure is a precondition for sustainable development. How it is precondition? Only when citizens are healthy, okay, they can produce healthy children. Okay, then you can bring in the issues of children, as Rajni said. Only when the children receive proper care for the first 1,000 days, they go on to become very healthy individuals, or else they become malnutrition, anemic, etc. So definitely the primary health care has the bearing on sustainable development. Okay, and then you can talk about the present day ailments like non-communicable diseases. Okay, in order, if the primary healthcare system is properly there, the NCDs can be recognized in the very initial stages and can be addressed. This also brings up the sustainable development angle. Okay, and then when primary healthcare is in the proper place, people, the dependency, direct dependency on the secondary and tertiary health structure is reducing, and the need of the hour is to bring more and more people access to the primary health structure. Okay, and then we can also go on to say, we can conclude by saying the importance of health in the sustainable development goal. Sustainable development goal 3. What is the importance of health as far as the UNSC is, the UNDP is concerned? You can explain that and conclude saying that primary health is a basic prerequisite for the sustainable development, and hence both are related. Okay, whose questions have we done yesterday in the chat window? Anyone? Sriram, Jitendra, Arvind. Okay, and then Vasavi and Soumya. Okay. So who are the others who have written? Sriram has written Venkateshwari, Anil, Hindu, Raghuram, Renuka. Okay. We'll see Renuka. Renuka, you have written the first question.
Yes, sir.
Today, Renuka, Raghuram, Hindu, Anil, and Venkateshwari will do. Renuka, I have done yours yesterday.
Yes, sir.
Okay. And then we'll do. Okay, anyhow, we'll see. If something repeats, we'll do, not a problem. Yeah, Hindu. Hindu points should be more formal, ma. Okay, people first run to the hospital when they got ill. This is very informal jargon. Avoid such points. Okay. Even the second point is informal. Yes, DPSP point is relevant. Primary healthcare necessary precondition for sustainable development. Okay, you can make much better points. You just see our model answer which we discussed right now and just try to write your answer again in line with our model answer. Hindu, because the points you have made, some points are relevant, but some points you have made it in a very informal way. So please correct them and necessarily make the corrections. Okay. Yeah. See the second one. In order to enhance the prospects of social development, sound and adequate healthcare policies are necessary, particularly in the field of geriatric and maternal healthcare. Discuss. Geriatric and maternal healthcare. Yeah. Framework. Yeah. Yeah. Good. Jitender, you got it right. Very much relevant
Yes, sir.
framework. Everyone see the chat window. I don't think anyone will disagree with the framework Jitender has given. Okay. You just need to give the introduction. Okay. Need for geriatric care. What is geriatric care? Anyone? What is geriatric care? What is geriatric care? Old age care or caring for the senior citizens. Good. Okay. So how do you want to introduce? So we can introduce saying that as India is also aging, because the average age of India is increasing. We will have more and more senior citizens who will need adequate attention towards healthcare and other aspects. Also, women are close to 50% of the population. And then many women are still not having access to formal maternal health care. You can introduce by these 2 points and then straight away give the side heading of need for geriatric health care. Okay, what is the need for geriatric health care? Aging population, people having more non-communicable diseases are growing, and many people after the retirement do not have proper savings, proper pensions. Okay, and then what else? They are sometimes away from the family, and because of the modern urbanization, there is lot of nuclear families which are growing up. So because of the nuclear families, the old age people are becoming isolated, no proper people to care them. So you can mention all these aspects about the need for geriatric care. Then what about the need for maternal health care? Not having proper access to institutional and formal deliveries. The neonatal care, care for the pregnant woman during second and third trimester. Okay, most of the rural areas do not have proper labor rooms, and then women have already certain bias or discrimination against them in the society, and many pregnant women are found to be anemic, and because of this anemic thing, it has a direct reflection on the child, who may face the triple burden of malnutrition, underweight and overweight. All these are important points for the need for maternal health care. Then you write government initiatives taken for these two regards. You have this Pradhan Mantri Vayo Vandana Yojana. Vayo means old age. Okay, old age pensions. And many states like Andhra, Telangana, they are giving old age pensions of 2,000, 3,000 along with certain food guarantee, more interest rates for savings of old age senior citizens, tax concessions for senior citizens, and then giving them access to healthcare. And then you can write about the Ayushman Bharat. Okay, then you can talk about, when we come to the maternal women, we can write about this scheme called Matrutva Vandana Yojana. Okay, PM Matrutva yeah, you can write about examples, Prashanti. Examples are many. Okay, KCR kit, if you talk about KCR kit, then the Jagan kit also will come into picture. So you can write about state government initiatives for taking up institutional deliveries, empowering the Anganwadis. That was a very big case study, right? Recently, the ASHA workers have been recognized by the WHO. So you can give such case studies, the present and running case studies where there are success, they're already successful. You give that case study, and then link that when these two aspects or the two important classes of the society are taken care with regard to the healthcare, then it is the true prosperity. Bring out in such a picture that when old people have access to proper healthcare and the institutional deliveries and maternal care is taken care, then we can speak about the true prosperity of the nation. And then conclude. And then conclude with regard to some sustainable development goal and other things. Clear?
Yes, sir.
Okay, Venkateshwari, I am looking at your answer. Somehow it is not visible here. I don't know why. Venkateshwari, you have taken too long to come to the core demand of the question. Okay, Venkateshwari, you should come to the core demand of the question, which is nothing but the geriatric care and the maternal care. You have taken almost 1 page to come to the core demand of the question. I hope you are looking at your answer. Okay, so come to the question, core demand of the question as soon as possible. First thing is that, and then you have to make points in a very slightly extensive way. Okay, you cannot write in a one word. We have discussed this many number of times. So slightly the point should be more comprehensive. Okay, more comprehensive. 1 minute. Yeah. So you see, you have taken almost 1 page to come to the core demand of the question. Okay. That's why you should, see, this entire page, you are explaining the need for proper health, etc. Okay, why the health is decreasing and all, but there has to be the side heading, and then you have not mentioned the side headings of how it is required for geriatric care and maternal health care. So the examiner has to understand that you have actually addressed the core demand of the question. Okay. Now that you have actually understood the model answer, again go through your answer, get it, you write it again, and then observe the difference. Okay. See the third question. Appropriate local community level healthcare intervention is a prerequisite to achieve health for all in India. Yeah. Yeah. Third question. I am seeing that many people have not written third question. You did not understand or what? Appropriate local level healthcare intervention is a prerequisite to achieve health for all in India. Seems to be straightforward question. Why many of you have not written? Why?
Sir, the question seems mostly similar to first question.
Huh?
The question seems mostly similar to first question.
Okay. So you will not write. Your ego got hurt. Huh?
Nothing like that, sir.
So that is what UPSC is there. 2018 question, if it is repeated in 2021, what is the harm in writing same? Of course, I agree that it is very much similar. Okay, that trend you have to follow. And then the minute differences in the questions you have to address, and that's where your answer writing skills will be shaping up. We have seen that, right? Even when we have done the polity or modern history, same question I used to rephrase and give it to you people. And I used to explain you how the core demand of the question in A is different from B question. Like that, the questions may be similar, but the core demand may be different. Here the core demand is the intervention of community level. Welfare state is with regard to the state. Community level is involvement of other stakeholders along with the state. That is the question. Do you agree the difference, Jitender?
Yes, sir.
Then is there any difference in the answer? Will there any be difference in the answer? Slightly answer will be different, right?
Yes, sir.
If you write exact answer for 1 as 3, will you make proper justice to the answer? So that small things only you need to learn. Okay. So that's why every question is important. And then if some question is say similar or getting repeated, then it is a much important question that you should write. Okay.
Yes, sir. No, sir. I am just saying framework, not the reason that I have not written for.
Sriram also has not written. I'm just saying he is silent. Maybe he also has the same logic. Raghu has written. Sriram, your logic is same?
No, sir. No, sir.
Yeah, I have seen some have written, some have not written. So I have not made a generic statement. I have said many of you have not written. Okay, right. So what will be the model answer for this? Basically, the question says health for all. Okay, health for all is it's like a slogan, right? So you can explain health for all means for all the sections of the societies, for all the classes and various parts of the society should receive health, okay, in a minimum and affordable way. In an affordable way, actually. Okay, an affordable way is health for all. The slogan health for all is basically access of health facilities to everyone in an affordable way. You can start by introducing that, and then you can directly bring into the angle of how community approach will help in achieving this health for all slogan or health for all idea or dream. Okay, how it will improve when you involve many people in the health, the awareness is increasing. The awareness for having proper health is increasing. For example, if you take the yoga is said to be having direct impact on health. So as we are promoting yoga, we are also at the community level, we are also indirectly promoting the health system. So awareness is increasing. Okay, when so many people are aware of the importance of health, the idea about the health and its outreach will increase. Okay, the outreach of the health programs will go on increasing. And also, when so many people are having access to health at the community level, the primary health centers will flourish because the demand for those primary centers will be there, and the doctor and the patient ratio is taken care. And also, when the government institutions are in proper place because of the demand for health, the poverty or the out of expenses, basically poverty is because of out of pocket expenses for health, that will come down, and poverty also will be mitigated to certain extent. Okay, and when poverty decreases, health grows, everyone will have access to proper employment and the income will grow. Okay, and you can say it will have direct impact on the economic growth of the country. Okay, you can say this health for all initiative or the approach at the community level is a win-win situation which can bring people together and create awareness for proper health and can address the sustainable development goal number 3. Okay, and also is in line with the slogan of Sabka Saath Sabka Vikas. It is in line with the slogan of Sabka Saath Sabka Vikas, and it will definitely have its impact on the sustainable growth and the socio-economic aspects of the society. So Rajni, what was your doubt? What exactly were you asking? Should we be adding one health approach here? What do you mean by that?
Sir, there was this concept called One Health that for the improvement in the health of the human species, all the species improvement has to be like, basically we have to be sustainable with the environment so that even our health will be better. Like I am not able to explain it better currently.
Okay.
But
You can give case studies or examples also where community health programs have actually. You can again mention Kudumbasri. Kudumbasri people actually promote this community level healthcare, and one brilliant initiative of Asha workers who are now recognized by the World Health Organization for their valuable services in the rural areas and the community level healthcare interventions. Case study here and then conclude on a very positive way. Is it clear?
Yes, sir. Sir, One Health means approaching
Yeah. Sriram, tell me.
approaching like human species, animal species, and environment all together, so that one problem from one will not affect the other. That is One Health approach.
Actually, I am not aware of that, so that's why I could not comment on Rajni's thing. Okay, if it is regarding the
Yes, sir.
entire species towards One Health, maybe it is not applicable here because we are talking about
Yeah, sir.
how community level health services will promote certain health for all approach. Rajni, okay. In that context, you can write the case studies
This
of
was
ASHA workers.
promoted by WHO, sir.
Okay, but you can in
And
community
even
level
Indian government
health, you
also
can,
adopting it.
yeah, you can write ASHA workers. You can write about the Pradhan Mantri Ayushman Bharat. Okay, all these are large scale initiatives taken to provide community health. Okay, or directly having impact on community health. PM Ayushman Bharat may not be a community health program, but it is definitely having impact on community health. Okay. Good introduction, Raghu. Yeah, increased outreach, addressing poverty. You see, this particular approach by Raghu is writing the point and then explaining it. What others, some of you are doing is simply writing the point, increased outreach. Increased outreach is the point, but what is the extension of that point you need to mention. So community level intervention meets the immediate needs of individual for accessing proper health care. So increased outreach itself has certain importance. So you have to explain that. So this is very good way of presentation. Presentation wise, see, he has made very simple and relevant points, but the presentation wise, he is making an impact. You see the flow of answer. I can read this answer in just 25-30 seconds and I can understand that he has made a lot of sense. So he is making my life easy, then obviously I like his answer. Are you able to understand? Yeah, Raghu, you have made all good points. You could add how community level health will bring in sustainable development goals, Sabka Saath, Sabka Vikas. Okay. You can also write one case study, Raghu. Case study in such community level health programs and all will really help in having edge over others. I'm being honest, any serious aspirant will write this quality of answer. But then if you want that extra mark, you need to do something innovative. Write the case study of ASHA workers, so on and so forth. Okay. Then for this, if it's a 10 marker, if you are getting 4 marks, if you give that case study or that example, you'll get 5 marks. That is our intention, right? Okay. See the fourth question. It is a question about WASH. To ensure effective implementation of policies addressing water, sanitization and hygiene needs, together referred to as WASH. Water, sanitization and hygiene needs, the identification of beneficiary segments is to be synchronized with anticipated outcomes. Examine the statement in the context of WASH scheme. To understand the question is a challenge here. Okay. The moment you understand the question, you will write the answer very easily. To ensure effective implementation of policy addressing water, sanitization and hygiene needs, the identification of beneficiary segments is to be synchronized with the anticipated outcomes. Examine the statement in the context of WASH schemes. What do you understand by the question and give the framework? Yeah. So you can write, you can see the structure given by Raghu. Intro about the WASH scheme, problems in implementing the scheme, what are the possible solutions, and conclusion or way forward. Good. So anyone who has written this answer, who's scripts have not evaluated yesterday or today?
Sir, is that framework given by Raghu is okay for this?
Yeah, because actually in the problems in implementing the scheme, you have to correlate. I'll explain anyhow. You have to correlate the issues in achieving the desired outcomes. Okay.
Yeah.
Okay. The basic question is that the outcomes as desired by the WASH scheme are not happening. What is the problem? Okay, the identification of beneficiary segments is to be synchronized with anticipated outcomes. That means I am having X as my outcome, provided the X is given to Y, instead of Y it is going to Z. So that means there is some problems in implementing the scheme. There are some problems in identifying exact beneficiaries of this scheme. And finally, there are problems with some outcomes of the scheme. So basically, you need to highlight these issues of the scheme and then give possible solutions to these issues, and then you have to conclude. Is it clear?
Yes, sir.
Hmm. Who has written this answer? No one? Only Raghu has written or what? Just a minute. Huh? Okay. So basically, as we discussed for this question, you need to write various aspects of the question. That is, what are the issues with the WASH scheme? What is the basic intention of the outcome? And are we having any issue with addressing the beneficiaries? And then the supposed solutions, and then conclusion. Okay. So you can start with the WASH scheme and how it is an essential public health program as and in line with the sustainable development goals. So in this context, the introduction by Raghu is good. Okay. It is basically intended to provide equitable and access water and sanitation for all the people. Okay. Then write issues with the scheme. Okay. What are the basic issues with the scheme? Basic issues with the WASH scheme. Okay. And these points are not required. Raghu, the 3-point mission, Bhagirath and all, you can quote them as part of solutions or examples. You need not mention them upfront. Okay.
Okay, sir. Okay.
Problems with the scheme. Okay. Water contamination, sanitation system is quite expensive, and even now there is a lot of human interference in the sanitation system. Okay. And then climate change, lack of innovative ideas. You have missed the beneficiaries part, Raghu. So that's what I think even Jitendra was asking. So beneficiaries part is important here. So in the WASH scheme, what was happening is people were being only like, poor people, low income people, people with a vulnerable background. These people were identified as the targeted segments of the WASH scheme. But then now it is realized that it's not necessary that people with lower incomes or poverty levels or etc. are actually the beneficiaries of WASH. Anyone who is not having access to proper water, sanitation and hygiene, they may be high or low. So now there is an increased awareness about targeting WASH scheme with regard to life cycle approach. So now the approach towards WASH scheme is more towards life cycle approach. That means how the human life cycle is being affected because of lack of proper WASH facilities. WASH means water, sanitation and hygiene. You might be living in villa, but if you are drinking a fluorosis affected water, your life cycle is impacted. So hence the beneficiaries, the intended beneficiaries, horizon is grown. It's not narrow. It's now a wider base of beneficiaries who are now targeted through WASH scheme. In solutions, you can write Mission Bhagiratha, definitely. Har Ghar Jal, a central government scheme. Atal Bhujal Yojana, which is trying to bring out the groundwater. Okay. And then, yes, beneficiary centric approach. Here again, you need to mention that the beneficiary base has to be increased with regard to the life cycle approach. Okay. And then bring in new innovative technologies like nanobots, nanorobots, or robots for sanitation and sewerage systems. Okay. And reducing open drains and having a proper drainage mechanism to improve hygiene. So all these solutions you can explain, and then again link the WASH scheme with the importance of sustainable development and how it can actually reduce the disease burden, including contagious and non-contagious diseases can be controlled by having proper water, sanitation and hygiene. You can bring down many diseases by having all these together. And with the bringing down of diseases, the overall health quotient of the government or the nation grows, which will actually add a lot of social and economic capacity to the India in general, India and world. Is it clear?
Yes, sir.
Jitendra, now is it clear to you?
Yes, sir.
Yes, sir.
Sriram,
Yes, sir.
others? Rajni, did you follow? Soumya, Anil, Indu, Swati?
Sir, simply it is a blend of futures and issues related to that futures and need the way forward for that futures in a single statement.
I did not get you. There was a lot of echo. Tell me again.
Yes, sir. Futures and the issues associated with that futures.
No, and you see, it is all, it's speaking about a particular thing, like in identification of beneficiary segments is to be synchronized with anticipated outcomes. So that's what I'm saying, right? Previously, WASH schemes were targeting the beneficiaries as people with poverty, low incomes, rural background. But apart from them, but then people with decent lifestyle are facing another kind of WASH issues. Not having proper access to potable water. You might be staying in a villa, but you are not having drinking water. Then it is an issue with WASH, right? So the identification of the beneficiaries is now enlarged. The life cycle approach is taken. That you have to bring it in the answer.
Yeah, sir.
Fine. See the last question. Professor Amartya Sen has advocated important reforms in the realm of primary education and primary health care. What are your suggestions to improve their status and performance? So the question is a very customized question. They are not asking what are Amartya Sen's suggestions. If you know Amartya Sen's suggestions, well and good. What are your suggestions? So very customized question where you can improve the exam, where you can impress the examiner with innovative and wonderful suggestions. So here in such questions, you have to score the brownie point. It is like ethics question now. It is in your zone. You have to answer as to what is the best way you think the primary education and healthcare have to be improved. And give case studies, give examples. If you know some collector who has done XYZ, do it. Anudeep has set up some 25 or 26 beds, very beautiful hospital in Khammam, Bhadradri. Can write such examples. Okay. So what is the framework for this question? Who has written this answer? Whose question I have not discussed yesterday or today? Anil, you have written? Anil, okay, I'll do it. Yeah. Then give your suggestions. It's all about your answer. Everyone, the question is clearly saying what are your suggestions? Yeah, what are your suggestions? So the question, the answers can be very diverse. Okay, because what is a solution for Sriram may be different for Jitender, and what is solution for Jitender may be different for Raghu. What is good for Raghu may be different for Rajani, Soumya, and so on. But the important part here is you should make all valid points, and if you are already aware of certain government scheme with regard to your point, mention that. It gives very good picture about, okay, you are writing informed answers. Okay, understood? Because there is already a lot of innovation happening in education and health. So you need not invent the wheel again. A lot of things are there. Try to explain them little bit from your perspective. And if you are aware of any schemes, like, for example, in education, in health, there is National Health Policy 2017. Okay, there is PM Vidyanjali, yes, volunteering in government school. And then you can write about the New Education Policy 2020, a very revolutionary reform after 34 years. Okay, you can write about many things. So basically you give the introduction if you know something about the Amartya Sen, how he told that these two important aspects, health and education, are very important in enabling the socio-economic growth of the country. He told that unless health and education are taken care, we cannot actually focus on the economic growth or the socio-economic growth. So that is what Amartya Sen said. Okay. Then you can come to how education can be improved. Then you have to give the suggestions, right? First, give suggestions for education. How primary education can be improved. What is the primary education? You can say that primary education is already constitutionally guaranteed under Article 21A of under the RTE Act. So we can further improve by ensuring that the desired quota of 25% is given to the people. Okay, and then the motivation of going to the school, that is the proper implementation of midday meal program. And along with the midday meal program, we can integrate the health also by giving sufficient nutritious food, by adding the micronutrients with the help of food fortification. Many states are doing it by giving proper protein based food to the children. And then you can create social capital, and you can create social capital by imbibing certain values to the students, like how discipline is important, how truth is important, how respecting the elders is important. Okay, and then you can also write the National Education Policy 2020 approach of 5+3+3+4, how it systematically has focus on the education part. You can say the importance of teaching in mother tongue so that the children can grasp it immediately. So all these are suggestions. These are my suggestions. You can have a number of suggestions which are innovative. Like you can write PM Vidyanjali Yojana as Rajni suggested. Any other schemes where you can mention which any case study which you are aware of. So that is with regard to the education. Now with regard to the health, again you can say how midday meal program and the Anganwadi workers have actually ensured the increase of the gross enrollment ratio in the primary education, which is close to 98% today. And you can write how the technology can be imbibed into the healthcare, and where people in the rural background can have access to the scans and other diagnostic facilities. In this context, you can give the example of Telangana, which is now having an app for free diagnostic services for poor people. And you can write about addressing the primary healthcare, addressing the new age diseases like diabetes, hypertension, etc. And emphasis on ensuring proper health, like having exercises in schools. So it's like having a healthcare system where it's more of a prevention than cure. So first of all, prevent from getting ill at all, and then giving proper vaccination to the children. You can mention Mission Indradhanush program. You can write under the health midday meal program, you can write about the Poshan Abhiyan, Sabala scheme. Okay, you can write about Ayushman Bharat, primary healthcare, Ayushman Bharat. You can write about Pradhan Mantri Jan Aushadhi scheme. Generic medicines are given at the government pharmacies. And you can write about ICDS, Integrated Child Development Program, scheme. Right from 1976, it's one of the pioneered scheme. The governments are changing, but the scheme is always helping. And you can write about Vayo Vandana Yojana. Okay, all these you can write and then conclude in a very positive way. Okay, that the human capital. So Prashanti has written a good sentence. The human capital in the field of education and health is the most important for the development of the country. So it's a very good statement. So you can directly take that as a conclusion. Okay, it is given by Amartya Sen, but then you can again use it somewhere in your introduction or conclusion. Clear?
Yes, sir.
So whose answer sheet was this? I just forgot. On the flow, I forgot. Anil.
Anil, sir.
Good introduction, Anil. Instead of writing in a cramped way, you could have written primary healthcare as a heading and then primary education as a heading. And then you have to make better points, like you are writing very like pointers. Avoid that. Okay. And diagrams are not labeled. Okay, this diagram at least I like. It's okay. The primary health diagram, it's okay. Primary education. Many more points can be added to primary education. You can write about the improvement in gross enrollment ratio with regard to the midday meal program and then other aspects. Okay, conclusion is good. Okay, slightly better presentation. You have made some good points, Anil. You can add much more points as we discussed in the class today. And then presentation can be slightly taken care.
Yes, sir.
Is it clear, everyone?
Yes, sir.
Sorry? Someone is speaking? So that's it for today. And then we'll again meet on Monday. Okay. So I'm seeing that some people are sustaining that writing. And one good example shared by Kalyan today, how the daily incremental thing can lead to wonderful outcomes. Okay, so that's what we are all trying to do basically in the exercise. So you can see that how daily 1% can improve you by 37 times. Okay, so basically now sometimes you'll get addicted to this. That's very good thing. So do this like a meditation, do this like a penance, tapassu antam kada. Do it like that without breaking. Keep on writing the answers. You are, just imagine, you are not writing some Vision Institute or Insight Institute answers. You are writing UPSC questions answers. A question which has been asked in the mains. Some of the toughest questions not answered by many people, where even toppers struggle to get 250 out of 250, where toppers struggle to get 100, 105. You are writing such answers. So it should give you confidence. It should give you moral boost. It should give you courage to write more answers. Okay. I'm being very honest with you. I'm doing this for passion. And I'm sure if you speak to Ramana sir, he'll also agree with that. I'm doing this only for my passion. And then why? Because I have seen that some people are genuinely interested in improving themselves. and they are continuously writing answers. It motivates me also to come to the class in a prepared way, better way. And some of the answers, of course, I have written in my previous mains. So when I see those questions today from this side, I feel really happy. And when you people are writing so good answers, I am also happy. So keep doing this day in, day out, like finance. Okay. And keep that motivation levels going. This exam is all about patience, motivation, perseverance. Okay. Many things may be obstructing your progress, but your willpower should keep on telling you guys, it's okay. Let me try. Okay. Because you people are very young, lot of energy. I know most of you do not have any direct responsibilities properly taken care. Okay. Like the Chiranjeev movie, you need not do cycling for 7 days and win bread and butter for your family. At least I know most of you do not have such a situation. You have time, you have energy, you have resources. Please concentrate, and then you will do wonders. Believe me, you will do wonders. Okay. It's just a pep talk. Sometimes I happen to give it, but it's required that you people also keep motivating yourselves. Okay. Have a proper weekend. Take care of the health. Lot of rains. Don't go crazy and mad. Take proper care of your health, and then we'll meet on Monday. Huh? Bye. Good night.